This just in, your child has Perthes. What to do? The first thing to do is don't panic. You're going to need to take a deep breath and possibly repeat that, maybe even several times. You're going to need to prepare because it's going to be a long journey. And you're going to also have to learn to deal with some uncertainty. We've already started kind of getting used to that in the first talk. When I say don't panic, the hip joint is very important, and especially to those of us that spend a lot of time thinking about it. But there is more to life. So we don't want the whole child's existence to center around their hip. When I say take a deep breath, I mean for everyone to literally do that, and also somewhat figuratively to learn and teach coping skills. As we're going to kind of talk about in this brief talk, it is a stressful thing that's going to affect the child and the family for some time. How do you prepare for a long journey? Well, first is you gather the team that's going with you. Obviously, your family and your friends are going to be involved in helping you and your child get through it. A physician is going to be involved, hopefully. And you'd like to have a physician that you can build a good relationship with, because you're going to have to work through some issues with answers that aren't crystal clear sometimes. Often physiotherapy is involved. And you may also need to think about some counseling in terms of dealing with the stress and the emotional toll. Physicians with experience, I think, are helpful. We may not always know all of the exact right answers, but at least we know what the options are. And I think it's important that you find a physician that you can build a relationship with, where you can talk through options and make the best choices together as a team for you and your child. And starting with the IPSG is one way to find people that have experience in dealing with Perthes. You're going to need to develop some different skills. So think about maybe what are some things that we can work on doing that are either non-impact activities, thanks to Perthes Kids for having all these great illustrations that we can use, or maybe pursuing non or less physical activities like music and etc. Also, think about the way that both you and your child tell your story. Is it a story of loss, or is it only, or is it a story of challenge and change that can be met and lead to some different opportunities? And then where's the map for this journey? It's a little bit difficult to find the right information. So you'd like to be working with experienced professionals. Most of the time these days, people are also going to turn to the internet. And you want to stick to websites that are going to have good information in rating the quality of information. In general, sites that have a healthcare input are usually more accurate and a little bit better information. Things like perthesdisease.org, that's the IPSG, the perthes.org that you're seeing, and then websites like OrthoKids is part of the Pediatric Orthopedic Society. And of course, talking to other patients and families can be helpful. Keep in mind, though, that the cases are somewhat unique. Age is a really important variable, and the cases that are either extreme or best or worst case scenarios are often going to stick out or be highlighted. So be careful as you're gathering information about comparing yourself to every different case that you hear about. How long is the journey? Well, it's going to be at least 2 years to get through the active phase typically, and there's going to be some additional discussion of this. But there's then, after it's healed, a longer period of time, and will also be talked about later, in dealing with the consequences as an older child or as an adult. And this is going to potentially have a significant impact on the quality of life. So this is one of the reasons that you have to be prepared for dealing with not only the physical, but the mental and emotional toll. And there's going to be a fair bit of uncertainty. Why is that so much the case? This is not a rare condition per se, but it's not extremely common either. So it's hard for centers and physicians to get a lot of concentrated experience. And so in this British study, there were only a couple of cases per 100,000 people per year, which works out to just a few cases per hospital in their study. It's also difficult because, as we just heard, we don't know the true etiology, and therefore our treatments are addressing some of the consequences, but not the root cause. It's also difficult to do conclusive research studies, in large part because it's so long between when the disease occurs, when we might have a chance to intervene, and when the hip has kind of reached its final state or has reached an outcome. So what do we know about the journey? One of the things that has been helpful is to ask caregivers and families, and they've expressed concern about this widespread variation in care, since it's not always clear that there's a single right answer. And they've told us they'd like to have more consistency, and I think that's also mirrored in the caregivers as well. Additionally, though, having a good relationship with your medical team will allow you to be included in the decision making and for you to deal with that uncertainty together. Also, another thing that you have to deal with is there are different horizons of time for the outcome. So, in the short term, we're trying to limit pain and try to keep children able to participate to the extent that's feasible. But in the long term, we're really concerned about the final shape of their hip. And sometimes the goals for those are different. And this was expressed by the 6-year-old that just wants to go to a bouncy castle, and the 10-year-old that's really waiting for his life to go back to normal. So just in summary, remember to take a deep breath, get ready for a long journey, and prepare for uncertainty. But if you have a good team around you, then you can make it a story of challenge and change and hopefully redemption. Thank you.